Gastrointestinal surgery has become a major attraction for healthcare investors due to the increasing complexity and pricing of procedures. This specialty has shifted more and more into the limelight and has fallen more comfortably into the title of high profile. The advances in this specialty are considered by some to be riding the fine line between breaking high-reaching boundaries and partaking in unnecessary operations. Over the next hour, we invite you to conversations about advances in existing technologies in gastrointestinal surgery. As a whole, the global medical device market has seen enormous growth within recent years. According to Fortune Business Insights, this market was valued at $425 billion and is expected to reach $612.7 billion by 2024. This equates to a steep compound annual growth rate of 5.4%. Making up approximately 3% of the overall medical device market is technology used in gastrointestinal procedures. Growing at an even sharper rate than medical device market as a whole, these instruments are projected to have compound annual growth rate of 6.7% in the coming years, and is set to reach $13.5 billion by 2027. The drastic growth in the market of the gastrointestinal device department is linked directly to the growing increase of gastrointestinal cancers and common gastrointestinal surgeries. In last year alone, 266,000 new cases of GI cancers were diagnosed, with 144,000 of those resulting in death. Also, 526,000 abdominal wall hernia surgical procedures were completed in 2006. 503,000 laparoscopic cholecystectomies alone were performed, and in 2010, there were 1.2 million hospitalizations involving liver disease. In terms of emergency procedures, in 2010, 12.7 million people required hospitalization due to digestive diseases, and 20.4 million ambulatory surgical procedures were performed. While these numbers are staggering, they don't come as a surprise, as tens of millions of people are affected by digestive disorders. In 2014 alone, more than 40.7 million ambulatory visits in the U.S. were due to GI symptoms, where 54.4 million visits resulted in a primary diagnosis for GI diseases, proving, once more, GI disease has a large contribution to healthcare in the United States, with total expenditures related to GI diseases currently at $135.9 billion annually. These disorders contribute more to healthcare costs than for any other common diseases. Along with the rates of digestive disorders and cancers, expenditures are likely to continue increasing. As a result, innovations in GI technologies are expected to continue to develop with the increased demand of improved needs of patient care in this space. The existing technologies in the space are those commonly found in colonoscopies, upper endoscopies, flexible sigmoidoscopies, upper endoscopic ultrasounds, and endoscopic retrograde cholangiopancreatographies. They include videoscopes, biopsies, ERCPs, capsules, ultrasounds, EMRs, and hemostatic devices. Moreover, non-invasive means of treatment and surgical interventions are becoming more common due to substantial impact of digestive disease on the U.S. population and healthcare system. All of these technologies that comprise the GI surgical market have had some recent advances. Some recently developed technologies include various non-contact methods of hemostasis via scope, such as argon plasma coagulation and radiofrequency catheter mucosal ablation therapy. These therapies aim to treat various GI disorders and complications. Argon plasma coagulation is a non-contact method for hemostasis. It is a type of electrocautery that uses ionized argon gas, plasma, to conduct electrical current from the probe to the tissue, because positively charged argon gas flows toward the negatively charged tissue. Therefore, treatment can be directed in an axial or tangential fashion. Radiofrequency catheter ablation therapies have been developed to treat dysplastic changes and mucosal abnormalities suspicious of malignancy, typically in the esophagus. RFA has shown to be safe and effective for the treatment of both low and high-grade dysplasia. Visualization has also improved with chromoendoscopy using stains to highlight variations in mucosa, and narrowband imaging has been used for higher resolution of vessel and mucosal imaging. There have even been developments for sleeker endoscopes and accessories. For example, semi-automated suture and stapling devices are coming to fruition. Small, handheld disposable devices, polymer-based adhesives for skin closures, and even endoscope and laparoscope semi-automated devices are being developed. Such devices are aiming to improve maneuvering hemostasis in tight scope spaces, leading to superior patient outcome. Technologies that embody miniaturization and visualization has and will continue to allow for the development of scopes that enable superior diagnostic and therapeutic outcomes. Further, this technology streamlines clinical care and reduces overall costs. An increased number of procedures will inevitably result in a greater incidence of treatable pathology. Other technologies are being developed to address additional unmet clinical needs with current minimally invasive approaches. Oftentimes, scopes images are blurred, making visibility challenging. Maneuvering hemostatic control can be challenging in a small space, and delivering drugs or obtaining biopsies are also challenging. Innovations in GI technologies are expected to continue to develop with the increased demand of improved methods of patient care in the space. Thank you for your attention during this brief introduction of advances in GI surgical technology.